how will the Department ensure that community mental health is a central component of this rollout so that patients can access multidisciplinary support before they reach a crisis point? As Hobhouse, we have a historic opportunity to build a national health service that treats the mind and the body with equal respect. I look forward to the Minister's response on how we will finally deliver true parity of esteem between physical and mental health services. Thank you.
The question is that this House has considered parity of esteem between physical and mental health. I call the Minister, Preet Kaur Gill.
Thank you, Ms Hobhouse, and it's a pleasure to serve under your chairship. And I'm very grateful to my honourable friend, the member for Blaydon and Consett, for securing this important debate and for her long-standing commitment to improving mental health services and her phenomenal work that she has done in her role as chair of the APPG Suicide and Self-Harm Prevention. I'm also grateful to all honourable members who have contributed today and shared experiences from their constituencies. And I was also sorry to hear of John's death. Men's suicide is a huge concern. I know many of us, me included, have personal stories that we can share, and there is much more that we need to do in that space. Ms Hobhouse, this debate speaks to the heart of what a modern health and care system should be. For too long, mental health has not received the same attention, priority or esteem as physical health. This has had profound consequences for individuals, families and communities across the country. It also has significant economic impacts, as we heard from my honourable friend, with an estimated 1.26 million 16 to 64-year-olds economically inactive due to mental health in 24-25. Now, the NHS Act 2006 states that when we talk about health, that does include mental health, and this government is committed to giving mental health the same attention and focus as physical health, and ensuring that people can access timely, high-quality support regardless of whether they are experiencing a mental or physical health condition. As my honourable friend said, parity of esteem means recognising that mental and physical health are inseparable, and far too often services have treated them as distinct issues when in reality they are completely connected. And of course, many people experience mental and physical health conditions at the same time, with a cause and effect relationship that goes both ways. We know poor mental health can increase the risk of developing physical health problems, while living with a long-term physical condition can have a significant impact on a person's mental well-being. And people living with severe mental illness experience some of the poorest physical health outcomes in our society, and on average die 15 to 20 years earlier than the general population. That is why we are committed to improving the way services respond to people with co-occurring mental and physical health needs. Care must be coordinated around the individual rather than organised around organisational boundaries, ensuring that people receive holistic support that addresses all aspects of their health and well-being. NHS England has developed the Mental Health Personalised Care Framework, which sets out how services should assess and manage people's care in partnership with them and in collaboration with all relevant teams. And this framework places particular emphasis on joined-up care, safety and risk management, and it has been tested with local systems and will be published shortly. And I know that that will answer some of her questions, but not all. And I shall try and address those points as I go through my speech. Yes, of course.
Annie Chambers.
Giving way. Talking about the wraparound care, we've got a fantastic initiative in Winchester where the Citizens Advice spends time with the Melbury Lodge, which is the inpatient unit, to help the patients get to all their life admin. It's a lot of debt issues, money issues. And it's been shown that they have a shorter stay in hospital, significantly less likely to be readmitted, and they're also they're also more likely to engage with social services once they've been discharged. Would the Minister be willing to meet with me and the team to discuss this initiative? Because for every pound spent on it, it saves £14.08 in cost avoidance for the NHS.
I thank the honourable member for mentioning the wraparound care in Winchester, CAB. It's initiatives like that that are in the voluntary sector or the charity sector that We do need the local health ecosystem to be partnering with, acknowledging the impact that they're made, and therefore funding and supporting these types of initiatives. You cannot underestimate the level of support that basic things, what some may think are basic, like debt, the impact on someone's mental health that can have. And I'm sure that the officials will want to meet with him and others to look at actually what the kind of landscape looks like across the country, because there are some fantastic initiatives that we do need to recognise, and we do need to partner and support. The government is taking action to elevate the status of mental health. For 26-27, NHS mental health spending is forecast to increase to a record £16.1 billion, representing a real terms increase of around £140 million compared with the previous year. Alongside this, the mental health investment standard remains in place. Integrated care boards are required to protect mental health spending in real terms over the next 3 years, ensuring that mental health continues to receive the investment needed to improve services and outcomes. However, investment alone is of course not enough, and we must transform how care is delivered. And that is why the 10-year health plan sets out our vision for a neighbourhood health service, something my honourable friend mentioned. This is about bringing care closer to people's homes and communities, creating genuinely patient-centred services, and moving away from what we've seen as a very fragmented system that often leaves people navigating multiple services without the support they need. And I hope the ICBs are engaging honourable members from all sides of the House to feed into what that neighbourhood health centre model will actually look like. What are the unmet needs and the services gaps in their own constituencies and regions? I will.
Thank you, Minister, very much for giving way. She's very kind with her time today, as always. The Health and Social Care Select Committee, as part of our inquiry into mental health services, visited the 24/7 neighbourhood mental health centre pilots and also Trieste, where the model originated from. They were clearly hugely successful already. She's mentioned the broader neighbourhood healthcare changes. Can she commit that the learnings from these hubs will be spread across the country, and will there be a clear roadmap for rolling out these services to every area?
I thank my honourable friend for his intervention. He's absolutely right. This is a great pilot, and there is some real huge successes. And of course, government must learn from the learnings and the impact that these hubs will have. And of course, we want to roll this out. That's why we're piloting 6 community-based health centres across England in Tower Hamlets, Lewisham, Whitehaven, York, Sheffield, and Birmingham. And these centres provide round-the-clock open access treatment and support for adults with severe mental health needs, and work closely with primary care and community services to provide joined-up care. I think all of us across this House will recognise that it is not appropriate for someone who's facing crisis or mental health to be sitting in A&E, which just exacerbates their condition and situation. And it's pilots like these that show actually a different model can work. And my noble friend Baroness Merron visited the East Birmingham community-based mental health centre in May, where she met staff and service users to hear directly about the impact of the service. And the visit demonstrated the important role that community-based mental health support can play in providing earlier intervention, improving experiences of care, and helping people access support before reaching crisis point. I know that my honourable friend is particularly interested in how these reforms will benefit people in Blaydon and Consent. And whilst her constituency is not currently home to one of the 6 core or 16 associated community-based mental health pilot sites, there is already a range of community-based support available locally. Gateshead Connects hubs are providing accessible community drop-in spaces that offer mental health and well-being support, alongside practical advice on issues such as housing and finances. And residents can also access NHS talking therapies through services based at Blaydon Primary Care Centre, while community mental health support networks operating across County Durham provide peer-led groups and safe spaces for people living in and around Consent. These local services reflect the wider direction of travel in our 10-year health plan, bringing support closer to people's homes, strengthening community-based provision, and ensuring that people can access help earlier before their needs escalate into crisis. Significant progress has been made in building a stronger crisis care pathway. This includes the NHS 111 mental health option. the expansion of crisis cafes that we hear from so many members, sanctuaries and crisis houses, and the rollout of crisis tech services across England. We've also completed delivery of the Mental Health Response Vehicle programme, with 88 vehicles now operating across local systems. In addition, there is now full national coverage of 24/7 liaison mental health teams in acute hospitals. And we are also investing up to £120 million to expand the number of mental health emergency departments to 85 sites. The Government has also delivered on its commitment to modernise the legal framework that underpins mental health care. The Mental Health Act 2025 brings mental health legislation into the 21st century and ensures that people receiving treatment have greater choice, autonomy and involvement in decisions about the care. My honourable friend mentioned the parity of esteem must extend to children and young people. We heard from many honourable friends of cases of children facing crisis, including my honourable friend. The Children and Young People's Modern Service Framework is currently being developed and remains on track for publication in autumn 2026. The framework will support a more integrated approach to physical and mental health. And members have rightly spoken about access to services and waiting times. It is unacceptable that some people are waiting far too long to receive the mental health care that they need, particularly young children and young people, as we heard from my honourable friend, and those experiencing a mental health crisis. ICBs must do more. No child should be left waiting. The Government has delivered its commitment to recruit an additional 8,500 mental health workers across the NHS, 3 years ahead of schedule, hoping to ease pressures on services and improve access to care. We're also expanding the NHS talking therapies and continuing the rollout of mental health support teams in schools and colleges to achieve full national coverage by 2029. We know we need to go further. I will.
I'll be quick. On talking therapies,
Adam Dance.
Rural Somerset. Some residents have said to me they are waiting 18 months to receive talking therapies, which is just not good enough.
I absolutely agree, and this is a responsibility of the ICBs, and the ICBs have been informed that they must make sure that waiting lists are coming down. We know we need to go further, and we are developing a new cross-government mental health strategy for England covering all ages, which will be published later this year. The Department is keen to hear views of members across this House, and I would be happy to share details with any honourable member in how they can feed in. The strategy seeks to transform mental health support by setting out a plan to respond earlier, reduce waiting times and help people to remain active. Importantly, it will look beyond the NHS, recognising the critical role of schools, employers, local government and the voluntary and community sector, because achieving parity of esteem is not solely the responsibility of the NHS. Today's debate has highlighted both the progress that has been made and the challenges that remain, and we are under no illusion about the scale of the task. But this Government is committed to building a health and care system where mental health is treated with the same seriousness, urgency and ambition as physical health. Parity of esteem is not an aspiration, it is a necessity. And through sustained investment, service reform and a renewed focus on prevention and early prevention, we are determined to make it a reality. I once again thank my honourable friend. I have a huge amount of respect and regard for her, not only for securing this debate, but all of the work she continues to do. And I know she will continue to hold us to account and for all members for their thoughtful contributions. Thank you.